Welcome to your ASCP preparation camp. I know you want to get smart about complex topics fast, so I cut through the noise for you, sorting through it all to bring you clarity on vital ASCP topics. Today I'm tackling something really crucial: liver disease. You've probably heard bits and pieces, maybe know someone affected. But I want to give you a really clear picture of what's actually going on inside this amazing organ. Think of this as your fast track to understanding the key signs, and maybe more interestingly, the whole process of liver scarring, fibrosis, they call it. I'll start with those warning signs, the signals your liver might be sending out. Then I'll really zoom in, go microscopic almost, to see how that scarring happens step by step, cell by cell. By the end, you'll have a solid grasp of what's happening and, crucially, why it all matters for health. Let's dive in. What are those first flags, those signs our liver might be struggling? Well, probably the most striking one, the one that gets people's attention, is jaundice, that yellowing of the skin and the eyes. It happens because the liver isn't doing its job properly processing bilirubin. That's a substance made when old red blood cells break down. If the liver can't handle it, it builds up in the body, and that's what causes the yellow color. It definitely catches the eye, a clear signal something's up with the liver's function. But fibrosis, the scarring, that seems central to what we're discussing today. It really is at the heart of many liver problems. It's the body trying to heal damage, like putting on a bandage, a repair job. But when that repair process just keeps going, it becomes excessive, chronic. That's when the real trouble starts. The repair itself becomes the problem. There are other signs too, maybe less obvious ones, like high blood pressure specifically in the liver's blood supply. They call that portal hypertension. That's a big one. And interestingly, you might even see kidney problems cropping up, which seems unrelated, but it can be linked back to the liver not working right. The body's so interconnected, it's amazing. Think about medications too. The liver processes most drugs, so if it's struggling, how your body handles those medications can change. That can be a clue. You might also see issues with nutrition, metabolic imbalances starting to show up, and something people might not connect to the liver straight away: bruising or bleeding easily. This happens because the liver makes the proteins needed for your blood to clot properly. Fewer clotting factors means more bruising. And finally, something doctors often pick up first: blood tests showing elevated liver enzymes. That's often the first objective sign that says, hey, we need to look closer here. These are all indicators, signals that definitely warrant a doctor's visit. Now let's focus on the liver itself. I called it a chemical processing plant earlier, and it really is. Think about it, all the blood coming from your stomach and intestines, carrying everything you've eaten and drunk, it all goes through the liver first before it goes anywhere else in the body. The liver filters it, processes nutrients, detoxifies harmful stuff, handles medications. It's constantly working. No wonder it needs a good defense system. It has to be ready to deal with injury and repair itself, which brings us back to scarring. I said it starts as a normal repair thing, like that bandage analogy. Exactly like a bandage, when the liver gets hurt, could be a virus, too much alcohol, fat building up, whatever the cause, its first reaction is to patch things up. It lays down collagen, other proteins, makes scar tissue. It's meant to be temporary, help things heal. But if the injury doesn't stop, if it's chronic, that bandaging process goes haywire. It doesn't switch off, it just keeps building more scar tissue. And that pileup of scar tissue? That's fibrosis. So the very thing meant to help ends up causing more harm if it goes on too long. A good intention gone wrong, essentially, the repair becomes the problem. Let's get into the nitty-gritty. Who are the actual cells involved in making this scar tissue? The main players? There are several key cell types doing different jobs here. Let's start with the hepatic stellate cells, HSCs for short. Normally, they're pretty quiet. They're kind of star-shaped, that's the stellate part. Their main gig is storing vitamin A, they're vitamin A storage units. But when the liver gets injured, they wake up. They transform dramatically. They stop storing vitamin A, they get activated, and they turn into wound-healing machines. And crucially, they start churning out scar tissue components. It's quite a switch, like a two-phase thing. First, they get activated, change their whole behavior, and then they just keep going, maintaining that scar production. So the quiet helpers turn into the main scar factories in chronic injury. It's fascinating in a worrying way, a biological switch flipped the wrong way. So HSCs are making the scar stuff. Who else is in this drama? Next up, let's talk about myofibroblasts. If the HSCs are making the raw materials, think of these guys as the project managers and construction workers combined, the ones actually building the scar. They're really active. They can move around in the liver tissue, so they're physically reshaping things as the scarring progresses. They multiply, make more of themselves. Plus they can contract, actually squeeze the tissue. That contributes to the liver getting stiff and hard when it's fibrotic. So they lay down the scar and make it contract. The main source of myofibroblasts is those activated HSCs we just talked about. But they can sometimes come from other cell types too. So HSCs make the stuff, myofibroblasts build and tighten it. What about the immune system? Is it involved? Absolutely. Big time. That brings us to Kupffer cells. They're specialized immune cells that live right there in the liver. Think of them as the liver's own little patrol units, the first line of defense, security guards, sort of. And they're particularly tuned into things coming from the gut, bacteria, toxins, stuff that gets absorbed and travels to the liver in the blood, right through that portal vein we mentioned. Their role in alcoholic liver disease is particularly interesting. With alcohol, Kupffer cells get really fired up. They react to the alcohol itself, sure, but also to bacterial toxins. See, alcohol can damage the gut lining, letting more toxins leak into the portal blood, the leaky gut connection. So these Kupffer cells get a double hit, and when they're activated, they release inflammatory signals. Those signals basically shout, danger. And that further stimulates those HSCs to make more scar tissue. So the immune patrol accidentally calls in more construction workers for the scar. Their numbers can actually go up or down, depending on how the chronic disease is progressing. It shows how gut health and liver health are so closely linked, it's such a complex chain reaction. What about the main liver cells, the ones doing all the processing work? Hepatocytes, right? They're the absolute workhorses doing most of the liver's jobs. And normally they're amazing at regenerating. If some get damaged, others can divide and replace them, like starfish regenerating a limb. But in chronic liver disease, that ability gets weaker. They can't keep up with the ongoing damage. Unfortunately, when hepatocytes die, that itself triggers more inflammation. So their death makes things worse, it fuels the fire. More inflammation means more signals telling those HSCs and myofibroblasts to keep scarring. It becomes a vicious cycle, a real downward spiral. The sources also mentioned lymphocytes, Th1 and Th2 cells. More immune players. These are types of lymphocytes, and they have sort of opposing roles in this whole scarring business. Generally speaking, Th1 cells tend to try and dampen down the inflammation and fibrosis, they're more like the anti-scarring team. Whereas Th2 cells tend to promote inflammation and fibrosis, they're on the pro-scarring team. So it's a tug of war between different immune cells. The balance between the Th1 and Th2 responses really influences how much scarring actually develops. If Th2 gets the upper hand, you tend to see more fibrosis. That balance is definitely a huge area of research, figuring out how to tip that balance back towards the Th1 anti-scarring side. Another cell type mentioned was liver sinusoidal endothelial cells, LSECS. These cells form the lining of the liver's tiny blood vessels, the sinusoids. So they line the pipes, basically. And they're not just a simple lining, they act as a very sophisticated filter. They have tiny pores that control what passes from the blood to the hepatocytes, the gatekeepers between the blood and the main liver cells. But when LSECs get damaged, maybe from inflammation or toxins, they lose those pores. Their filtering ability gets messed up, which disrupts things further. But here's something really interesting and hopeful about LSECs. Healthy ones seem to play a role in reversing fibrosis. They can help undo the scarring. They can release signals that calm down those HSCs. So keeping LSECs healthy or helping them recover could be really important for healing. That adds another layer, potential for reversal there. One more cell type, platelets. I thought they were just for blood clotting. That's their main job, absolutely, stopping bleeding. But it turns out they're surprisingly involved in liver disease, too. Platelets carry and release a lot of different growth factors and signaling molecules. And these signals can influence those other cells we've talked about, the HSCs, the immune cells. They can affect both scarring and healing. So they're not just passive bystanders. And here's a weird thing, in chronic liver disease, the platelet count in your main bloodstream often goes down. That fits with the bleeding risk. But paradoxically, platelets tend to accumulate inside the damaged liver tissue itself. So fewer in the blood, but more gathering at the scene of the crime in the liver. And once they're there, they interact with the other cells, releasing their signals and influencing how the scarring progresses. Another complex interaction, it's like a whole ecosystem in there with all these cells talking and reacting to each other. Let's talk now about a big question that usually comes up at this point: can fibrosis be reversed? And the short answer is, yes, potentially. That's a huge shift in how we think about chronic liver disease. For a long time, people believed that once the liver scars, that's it, permanent damage. But now, we're realizing that under certain conditions, fibrosis can actually regress. The scarring can soften, and the liver can regain function. Not always, and not in every stage, but it's possible. So how does that reversal happen? The key lies in stopping the ongoing injury. Whether that injury is coming from a virus, alcohol, fatty liver, whatever it is, the first step is to remove or reduce the source of the damage. Once that's done, the body can shift gears from damage control mode to healing mode. Here's where those activated hepatic stellate cells come back into focus. Remember, they're the ones laying down scar tissue. But if the signals that were activating them stop, they can become inactive again, or even die off through a process called apoptosis, programmed cell death. If they calm down or disappear, the scarring process slows, and in some cases, existing scar tissue can be broken down by special enzymes. Plus, those liver sinusoidal endothelial cells I mentioned earlier, the gatekeepers lining the blood vessels, they can help guide the healing. If they're functioning properly, they release signals that promote scar breakdown and support regeneration. That's why there's growing interest in therapies that protect or restore these cells. Even the immune system plays a role in reversal. Some immune cells actually help with cleanup. They digest and clear out old scar tissue and help the liver remodel itself back toward health. But here's the catch: time matters. The earlier the injury is stopped, the more reversible the damage tends to be. Once fibrosis advances into cirrhosis, which is essentially end-stage scarring where the liver's structure is completely distorted, the chance of reversal drops significantly. At that point, the liver's architecture is so damaged that it's like trying to unbake a cake. You can still slow the progression and manage symptoms, but full reversal becomes much harder. That's why early detection is everything. Finding fibrosis before it gets to that point opens up the best chances for recovery. And this is where modern tools are getting better. We've now got non-invasive tests, like FibroScan, and blood-based biomarkers that can give us a good idea of fibrosis level without a biopsy. That's a game changer. Now, in terms of treatment, there's a lot happening. Right now, most treatment strategies focus on removing the cause: antivirals for hepatitis, alcohol cessation, weight loss for fatty liver, better diabetes control. These are the cornerstones. But what's exciting is the research into drugs that specifically target fibrosis itself. Some are aimed at blocking the activation of stellate cells, others at boosting the breakdown of scar tissue. There's even work being done on using gene therapy, stem cells, and targeted delivery systems to get medicines right to the liver cells involved in fibrosis. It's still early days, but the pipeline is promising. And this brings us to the bigger picture. Liver fibrosis isn't just about the liver. It connects to broader issues: metabolism, the immune system, the gut microbiome. That's why doctors and researchers now talk about the liver as a central hub of health. If your liver's not happy, nothing else in the body runs smoothly. And that's what makes understanding liver fibrosis so important. Because if we catch it early, we can change the story. We can stop the progression. Maybe even reverse the damage. The liver is one of the most resilient organs we have. It wants to heal. We just have to give it the chance. So that's the deep dive for today. If you've made it this far, you now know more about liver fibrosis than most people, probably even more than some first-year med students. And hopefully, you're walking away with a much clearer picture of what's going on inside when the liver gets injured, how it responds, and most importantly, what can be done about it. Thanks for sticking with me. I'll see you in the next episode, where we take another step to break ASCP topics down together.